students, if you have some questions, please feel free to ask Professor Semenza.
Hello, hi Professor and Professor Semenza. My name is Anas Kanji and this is my colleague Paula Pusute. And we have some questions that we would love to ask you. But first of all, we would like to thank you very much for being here today, for your very good presentation, which was very easy to understand even for us, and for your inspiration. Thank you very much.
Thanks for your kind feedback.
Thank you. So my first question that I'm itching to ask is related to the Warburg effect. So I'm thinking in the treatment here. You've mentioned that we are targeting treatments that target both HIF1 and 2, like S9N, and you also mentioned belzutifan, which only targets HIF2. But if the cancer has an alternative pathway, which would be the Warburg effect, do we need to also focus our treatments in inhibiting this effect, which would be aerobic glycolysis, which would grant the energy to the cancer cells?
Right. So as you may know, if you've ever seen a chart of metabolic pathways, they're very complicated and nonlinear. So it's more like a web of different reactions. And as a result, you can block one of these pathways, and there are alternative mechanisms to get around the block, right? So this makes targeting metabolism very challenging. Now the HIFs, because they're affecting the expression of many genes in a pathway. So for example, coordinately regulating all of the glycolytic enzymes and glucose transporters, they can have profound effects on metabolism. And because we're giving the drugs systemically, we can hopefully get to all the cancer cells that way. So metabolism is undoubtedly one way in which HIF inhibitors exert a pressure on the cancer cell. I mentioned another, which was angiogenesis, right? To deliver oxygen and glucose, right, to the cancer cells, because regardless of their metabolism, they need glucose to burn. And then effects on the immune system to protect the cancer cells from killing by immune system. So this is the power of the HIFs, is that they're operating, at each of these critical aspects of cancer progression. The HIF inhibitors are having a role. And we believe it's that unique ability to target so many pathways that are important to the cancer cell that we can have this profound effect. Still, though, probably not even by themselves, though, right? Because as you saw, we could block tumor growth when we just used a HIF inhibitor, but we couldn't eliminate the tumor, right? It was the combination of immunotherapy and HIF inhibitors that allowed us to eliminate the tumor. And I believe that this will be the most powerful use of these compounds, is that they will be added to existing therapeutic regimens and make those regimens work better. And that includes immunotherapy, but I think it includes many of the targeted therapies as well. Because it turns out that many of the signaling pathways that are turned on in cancer cells, one of the effects is to increase HIF activity in an oxygen-independent manner. And so when you inhibit those pathways, you actually have an effect on HIF activity, and you cause hypoxia within the tumor, which just increases HIF activity again, right? And so you need to block. And the classic example is a VEGF inhibitor, right? Why don't they work for cancer? They reduce primary tumor growth because they block vascularization, but they make the tumor much more hypoxic and therefore much more likely to invade and metastasize. not a good thing for a cancer therapy to do, right? And this is why they have not been successful as cancer therapeutics. If you combine them with a HIF inhibitor, that might be a different story. So we really think that these dual HIF inhibitors will have many roles as a way of improving existing therapies. And so far we've done experiments in mice. That's just one step along the way. We know that what the challenges in patients are much greater. But unfortunately, the only way we can find out is to perform clinical trials. So we're trying to get to that stage of being able to perform a clinical trial. We first have to do additional safety studies in larger animals to be sure, or to have a greater assurance, let's say, that the compounds will not have a severe adverse effect in patients. But unfortunately, even that we only know by performing the first early studies, where we slowly increase the amount of drug that's given to patients, so that we're sure that we won't give a large dose that might have a very severe adverse effect. So that's sort of where we are. And could the HIF inhibitors in combination with a drug that targets metabolism, could that be a good combination in certain tumors? Certainly, it may be. It may be. So I will leave that up to you to find that
hopefully one day
that metabolism targeting drug that will work well in a combination with a HIF inhibitor.
Thank you.
Because obviously, yeah, we publish our data with the hopes that other people will try to extend our results in areas where, of greatest interest to them.
Absolutely. Thank you very much.